Okay. Welcome, everybody. Kelly?
So we wanted to take the opportunity to welcome everybody. I'm Kelly Martin. I'm the director of the Children's Care Management Program for the Association for Mental Health and Wellness. We wanted to take some time to let you meet our team and to get to know what our program does. So we are going to have some of our team coordinators and care managers speak on what all the intricacies of our program are. Anna?
Hello, my name is Ana Fernandez. I am the Assistant Director of the Children's Care Management Program. Hola, me llamo Ana Fernández y soy la asistente directora para el programa del manejo y la coordinación de la atención para la salud mental infantil.
Hi, everybody. My name is Melissa Bausch. I'm one of the team coordinators for the program.
Good morning. I'm Christina Lieberman. I'm one of the team coordinators for the Children's Care Management Program.
My name is Sarah Brown, and I am also a team coordinator for Children's Care Management.
So Melissa, did you want to start talking about some of the things about our program?
Sure. So I'll talk a little bit about the goals and what care management looks like. The primary goals of children's care management are to improve care and health outcomes for children, also to reduce preventable emergency room visits and hospitalizations, and to lower the cost of healthcare and social services.
Melissa acaba de explicar que el objetivo de este programa es para mejorar la atención médica y los resultados de la salud, igual a reducir aquellas visitas y a las hospitalizaciones que pueden ser evitadas y también reducir los costos de la atención médica a los servicios sociales.
Okay, and what is care management? What does it look like? Care managers assist children with physical and behavioral health challenges to access and coordinate all of their healthcare and social service needs. As care managers, we work with the family to develop a personal care plan to meet the child's needs. Some needs may include physical health, mental health, chemical dependency, and social service needs.
Las coordinadoras de atención ayudan a los niños con dificultades de la salud conductual o de la salud física. También ayuda a tener acceso a los servicios necesarios y a coordinar todas las necesidades que tengan de servicios sociales y la atención médica. Y los servicios incluyen lo próximo.
We also coordinate with the families and providers that work with the child to monitor and evaluate ongoing effectiveness of the child's care. We provide follow-up from inpatient hospitalizations and emergency room visits to help prevent re-hospitalizations. And we also assist children and families with gaining access to important resources such as public assistance, housing, childcare, food pantries, and transportation.
Parte de los servicios que damos es creamos un plan personal para satisfacer las necesidades físicas de la salud mental, de la dependencia química y de los servicios sociales. También coordinamos y monitoreamos y evaluamos la efectividad continua de la atención al niño. Damos seguimiento después de la atención médica recibida, así como los pacientes que pueden estar internos en el hospital para prevenir las reincidencias. También ayudamos a los niños y a sus familias a tener acceso a los servicios importantes como la asistencia pública, viviendas, guarderías, bancos de comida y transportación. También ayudamos a educar sobre la salud y la conducta, sea física o del comportamiento, y damos los apoyos necesarios a los niños, a los miembros y a sus familias.
Hi, and just to piggyback off of Melissa on what else a care manager does, the care manager provides physical and behavioral health education and support for the child, their family members, and other caregivers involved. We ensure that all providers share vital information to ensure the most safe and effective services. The care managers do this electronically, in person, and via phone. The care managers also work in teams to connect with children in their homes and at healthcare, education, and social service sites across Suffolk County. Our teams also reach out to engage children and their families in hospitals and those referred by community agencies, families, schools, health, behavioral health providers, and other social services.
También ayudamos a asegurarnos que todos los proveedores de la atención médica compartan información importante de manera electrónica para que los servicios que estén recibiendo sean más efectivos y seguros.
So I'm going to be talking about the eligibility and what would qualify your child for children's care management. So the first qualifier and, most important piece is they must be Medicaid eligible. With a qualifying Medicaid eligibility, there are other eligibility requirements that also must be met. The child can have a single qualifying condition, such as a serious emotional disturbance or SED, or a diagnosis such as HIV or AIDS.
Para poder calificar para este programa, debe de calificar para Medicaid y también debe de tener un diagnóstico médico. Puede ser sobre lo siguiente: un disturbio emocional severo o dos o más de las siguientes condiciones crónicas: uso de alcohol o drogas, una enfermedad de la salud mental, enfermedad cardiovascular, enfermedad metabólica como la diabetes o enfermedad respiratoria como el asma.
The child can also have 2 or more chronic conditions, such as a mental health condition, diabetes, a respiratory disease such as asthma. Additionally, they can also qualify via complex trauma or repeated exposure to multiple traumatic events in their lifetime.
O los niños también pueden cualificar si tienen trauma complejo para el programa, queriendo decir que han tenido una exposición el niño o adolescentes a eventos dramáticos a través de la vida.
Okay, thank you. Thank you. So I'd like to open it up to questions. If anybody has any questions specifically, obviously not related to a specific child, but more in general.
My program, we get youth and families on Medicaid all the time.
Okay.
That's about 85% of our families. Now, would they, because they're on Medicaid, qualify for these services?
Not automatically. They have to have the SED diagnosis or 2 chronic conditions. And a chronic condition, could be asthma and ADHD.
Gotcha.
Or asthma and obesity. There also has to be, a deficit in functioning, so
Right.
You have a kid who's doing well on their ADHD meds and there's not a problem at school and, they're doing well at home, wouldn't necessarily qualify. So there
Right.
has to be some functional limitations.
Which, again, there usually is in some other area. So,
Terrific. So
If you had any questions about a case that you were interested in referring, you can always contact me and we can discuss it. And definitely we would work with you to get the referrals through.
okay, thank you.
You're welcome.
any other questions? Because I'd like to introduce the rest of the team as well.
I think also just to point out for our program, we service all of Suffolk County, so that's Western Suffolk all the way out east.
Yes.
So we go all the way to both East Ends.
Well, that's us too. You never realize how long Suffolk County is until you do it.
That is for sure. I mean, right now, obviously, much of what we're doing is virtual. However,
Unfortunately,
our
us
care
too.
managers are still out there in the community, and they are delivering food on a weekly basis from our food pantry to the families, dropping off laptops, tablets.
That's awesome.
Helping them get connected to Wi-Fi, etc. So despite
Hats off to you. Really. Great job.
They're doing a great job. So I'm kind of gonna go in order here, and maybe, you know, people could just raise their hand so that you can see when I call your name. We operate in 4 teams, and each team has 4 to 5 care managers with a team coordinator. I'm just going to start introducing everybody. So we have Altagracia Batista, who's one of our care managers.
You got to raise your hand higher so everybody can see.
Yeah. We have Michael Baptiste. Yeah, Michael. Christine Powers. Noelia Diaz. Dakota Ernst. Jessica Wells. Yolanda Chalco. Amanda Jacobacci. Suling Villon. Amelia Andrade. Lindsay Coughlin. Amelia Alvarado. Wait, everybody moved around. Now I can't I can't find you. I'm sorry, it's Evelyn Alvarado. People moved. I got confused there. Sorry about that, Evelyn. Dominique Zumo. Literally, the screen just completely changed on me. Laura Ponce, Amanda Tavares, Chantel Jefferson. We got Ben Tompkins, and I think we got our whole team.
Yes.
I think, you know, one of the strengths of our team, obviously, in its diversity, is that we have, for the most part, a pretty wide range of languages spoken, obviously, between Spanish, English. We have one person who knows American Sign Language. We can get away with some Italian and French, and I believe Haitian Creole, if I remember correctly.
Mm-hmm.
So, you know, we really try to serve as diverse a population as possible. I'm very proud of our staff and the work that they're doing.
Absolutely.
At this point in time, I mean, despite, you know, COVID, where, you know, we've, you know, disenrolled a number of kids at the family's request, we've also been taking referrals. And we are upwards of over 400 children being served right now by this amazing team in Suffolk County. So there's a lot to be proud of in the work that they're doing.
Absolutely. And for anybody who's on here that would like to refer a child, they can reach me by, my email is kmartin, KMARTIN @MHAW.org. And my phone number is 631-389-6336.
Would anybody like to ask any other questions? If there's no other questions, we can kind of wrap up, and, you know, feel free to reach out to Kelly Martin, the program director. Our information is also on our website, www.mhaw.org. We can be found on Facebook, Instagram, YouTube, and a couple of other places, I'm sure. But I want to thank everybody for coming by. And again, any questions, don't hesitate to reach out.
Absolutely.
Take care, everybody.
Thank you.
Thank you.
Take care.